On this Saturday night, pandemic records across Canada. The even more desperate demand for the vaccine.
People who are actually giving the shots on the front line should also be calling the shots.
The challenges of getting the shot to the most vulnerable. The growing COVID-19 crisis in the First Nations community. What's the federal plan? Plus, basic income for the disadvantaged.
I wasn't making enough money to live.
The push to keep temporary benefits after the pandemic. And a Canadian couple's custody battle.
We're doing this because we love them.
Why a court in Peru won't let them see their grandchildren.
Global National with Robin Gill.
Good evening and thank you for joining us. It was another record-breaking day in Canada's biggest COVID-19 hotspots with new daily highs of COVID-19 cases. Alberta is reporting 1,879 new cases in the last 24 hours, the most recorded in that province in a single day. Ontario recorded 1,859 cases, and Quebec has become the first province to record over 2,000 new cases. Nowhere is the situation more dire than in Canada's long-term care homes. When the vaccine finally rolls out, there are calls for the first doses to protect the most vulnerable. Abigail Bimman has our top story tonight.
Barbara Beggs died in an Ontario long-term care home in October. Her daughter, Joanne, not allowed to see her during the first wave of the pandemic.
Her being isolated, me not being allowed in, I would have been all over that so much earlier. You know, maybe she could have kept the use of her hands. Maybe she didn't have to suffer like that so long.
Beggs now worries about her father in long-term care. She wants to make sure essential family visitors like her have access to the vaccine in the first round.
Our loved ones cannot afford being barred from us once again.
The thing we've not heard yet in the news that we're waiting for is clear messaging around the prioritization of our long-term care seniors, our residents, our staff, and our essential visitors.
Provinces are responsible for decisions like that, but a military planning directive obtained by Global News shows Track 1 vaccines, those first 6 million doses, will be handled by a federally coordinated strategy because provinces don't have the infrastructure nor experience. And the Federal Vaccine Advisory Committee recommends long-term care residents and staff be vaccinated first.
We hear information about when this vaccine is going to be ready to be basically put into people's arms, and yet we still don't have the list of priority people who are going to get it or how they're going to get it.
Those are actually the types of issues that we are actively discussing with our counterparts in the provinces and territories.
It's a complex process, especially for the Pfizer vaccine, expected to be approved first. It needs to be stored in ultra-cold freezers and not move too much.
So I think the key question now is what models are ideal for vaccinating people that might not be mobile.
We're going to need to start having these conversations with thousands of substitute decision makers. So you can't just, be told within a day that the vaccine is coming. This sector needs to be involved. And right now, they're kept in the dark.
People who are actually giving the shots on the front line should also be calling the shots.
Palliative care physician Dr. Amit Arya specializes in long-term care. He says those in the sector need a seat at the table in the planning.
I think it would reassure people to have a clear plan in place to know these are the benchmarks, this is the plan, with an understanding that some flexibility.
The Ontario government tells Global News it will have more to say on all pieces of its vaccine rollout plan soon. Abigail Bimman, Global News, Ottawa.
Ottawa will send Canadian Forces Rangers to assist with the COVID-19 response in a remote Indigenous community in Manitoba. The military confirms 6 Rangers will head to the Shamattawa First Nation. Once on the ground, they will help distribute vital support, including food, firewood, and care packages. It's a fly-in community located 745 kilometers from Winnipeg, and it's home to about 1,300 people. As of today, there are 144 confirmed cases of COVID-19. The test positivity rate in the community is 68%. It's just over 13% for the entire province. There are daily flights carrying patients to Winnipeg, and a local gymnasium has been converted into a self-isolation facility for people who have tested positive. An infectious disease expert specializing in Indigenous health tells Global News capacity needs to be built up in remote First Nations communities. and that they must be a priority when a COVID-19 vaccine is rolled out.
We're doing what we can for Canadians that are not Indigenous. These communities are in trouble. We know that once it gets in there, it can go widespread. And already we see that there's higher percentages of First Nations people in the hospital in Manitoba, higher percentages of ICU admissions and death.
In Manitoba, Indigenous people make up 30% of all current COVID-19 hospitalizations and 42% of all ICU patients. At least 47 Indigenous people have died from COVID-19 in the province, including a boy under the age of 10. A Manitoba church has lost a legal fight to hold drive-in services. The Springs Church in Winnipeg has been fined $32,000 by holding services in its parking lot. That's a violation of public health orders. The pastors took the province to court, arguing it's no different from sitting in a drive-through lineup or waiting at a red light. But the judge sided with the Manitoba government, which insists online church services at home protect lives. A popular Canadian singer is out of a job for taking part in an anti-mask rally.
Oh, Canada.
Mark Donnelly performed today at a protest against COVID-19 restrictions. He's best known for singing the Canadian anthem at Vancouver Canucks games, but the team fired him last night, saying Donnelly does not represent the team and that everyone should follow provincial health orders. In the U.S., COVID-19 has surpassed heart disease as the leading cause of death in America. More than 11,000 people lost their lives in just 7 days. And as Jennifer Johnson explains, health experts warn it could get worse if new measures are not brought in.
For the first time, the U.S. Centers for Disease Control and Prevention is recommending universal mask wearing at all times outside your home. Doctors say the pandemic has entered a new phase of high-level transmission.
More deaths than in the entire Vietnam War just in the past 2 months. And the next 2 months are likely to be as bad or likely worse.
Starting next week, the Food and Drug Administration will begin issuing emergency use authorizations to vaccine makers, hoping within days healthcare workers and those in long-term care facilities will start to get immunized.
Getting the nursing home residents vaccinated in December, when they make up such a significant point of hospitalizations, we'll start to see that impact in late January.
Once approved, the federal government will ship vaccine doses to each state. Hospitals and pharmacies will then administer them. The big chains say they are ready.
This is a process that is not new for us. We have serviced long-term care facilities for many years now.
The strain is taking its toll on healthcare workers, with over 100,000 Americans hospitalized with the virus.
It is difficult. Nurses are the last person that they will see and their last breath.
Many governors are ordering new lockdown measures. Some are furious. People are still going to large gatherings, like this secret Young Republicans gala in New Jersey, attended by a Florida congressman.
That is Representative Matt Gaetz. I hope you're watching, Matt. You are not welcome in New Jersey.
Leaders are frustrated. Too many Americans are still not taking this pandemic seriously as families continue to bury loved ones. This Oklahoma man lost 4 of his siblings.
I'll see him again. You got to believe that.
Larry Anishat also tested positive for COVID-19 in October, but he was one of the lucky ones in his family to survive. Jennifer Johnson, Global News, Washington.
Russia has started rolling out its homegrown coronavirus vaccine. The shots are being offered to people from high-risk groups, including medical workers and teachers. But it's only being given to people between 18 and 60 years old who don't suffer from chronic illnesses. In August, Russia gave the 2-shot Sputnik V regulatory approval, despite tests only being done on 76 people. The vaccine has not finished the advanced studies needed to ensure its effectiveness and safety. This coming week, Britain will start its first round of COVID-19 vaccinations. It's a major logistical and life-saving initiative. The United Kingdom granted emergency approval to the Pfizer vaccine on Wednesday. The vaccines are made in Belgium, and the first batches have arrived in the UK via the Eurotunnel. Here's our Europe Bureau Chief Crystal Goomansingh on what happens now.
I just wanted you to confirm that you have consented to this vaccine. Yes.
Practices and procedures are being rehearsed as the nation gears up.
Nervous,
excited that there's something out there that can protect us as well as our patients.
The UK government has a targeted attack plan with a focus on those most at risk of dying from COVID-19. Because the Pfizer-BioNTech vaccine has very specific temperature storage requirements, inoculations will initially take place in hospitals involving older individuals and medical staff. Military personnel have also been called in to assist in the rollout, especially when it gets to the community stage. The minister in charge of vaccine deployment tweeted from a planning session Friday, writing, "The excellent coordination in place across the system will be crucial."
I'm healthy. I want to rely on my own immune system, so I would not get the vaccine.
The world has stopped since a year, so we all want to get out and be safe.
Even those who say they'll take the vaccine have questions about its safety. It was tested in clinical trials involving more than 42,000 people. Half were given the vaccine. The worst side effects were said to be headaches and fatigue.
The public can be absolutely confident that every rigorous check has been done to reach the judgment that we reached, that the benefits far outweigh any risk.
That message has been shared repeatedly since the vaccine was granted emergency use by the UK's regulator, and it will continue to be shared with every person who rolls up their sleeve for the shot starting next week. Crystal Goomansingh, Global News, London.
Tonight, there are calls to make the Canadian Emergency Response Benefit, or CERB, permanent. In 2017, Ontario implemented a pilot project to look into the idea of basic income. Essentially, people were given a set amount of money to cover housing and food, but that program was cancelled. Tonight, Mike LeCouture takes a closer look at bringing it back nationally.
3 years ago, Jessie Golem never had time to do something like this. She was stuck working 4 dead-end jobs for up to 80 hours a week.
I didn't really feel like human when I was doing those jobs, because you make money so that you can live, but I wasn't making enough money to live.
In 2017, Golem was part of the Ontario government's pilot project to provide a basic income to 4,000 low-income earners. Just a few months later, the newly elected Progressive Conservative government scrapped the project, claiming it was a failure. Golem channeled her anger into action, creating a portrait series called Humans of Basic Income.
There's Roland. He said he struggled with addiction and homelessness, but basic income helped him get out of poverty, and then he went to school and got into a trade.
And then the pandemic hit, exposing societal cracks, especially for racialized and disadvantaged communities. The Canada Emergency Response Benefit became a lifeline to millions of Canadians, and now there's a push to continue it.
I do think that basic income and policies associated with it have the potential to improve health outcomes, but also reduce healthcare utilization, like a stay in a hospital or a visit to an emergency department.
Ontario's project wasn't the first. In 1974, the small town of Dauphin, Manitoba, became the test case for something dubbed Mincome. Researchers wanted to see if people stopped working after you gave them a basic income. But that didn't happen, according to Evelyn Forget, who studied the program decades later. Her study found the vast majority of those employed stayed employed.
So the people who left school at age 16 certainly got a job at the time. They were working in the short run. But over the longer run, they would have had far fewer opportunities, and they would have been able to offer their own children fewer opportunities as well.
Detractors say it's too expensive and we can't afford it. In July, the Parliamentary Budget Officer was asked to look at the cost of a post-pandemic guaranteed income program, and it's estimated to cost anywhere between $47.5 and $98 billion. There is cross-partisan support for some kind of livable income program, but it's not the government's top priority yet.
I think if there's any country that can do this, we have a chance to not only build a better world and lead an economic revolution, we have a chance to lead something on a world stage.
Mike LeCouture, Global News, Ottawa.
For an in-depth look at universal basic income, be sure to tune into The New Reality tonight with Donna Friesen. Coming up, is there a behind-the-scenes negotiation to free the two Michaels? It's been 2 years since Canadians Michael Spavor and Michael Kovrig were detained in China. Their arbitrary detention followed the arrest of Huawei CFO Meng Wanzhou in Vancouver on a U.S. extradition warrant. There are reports the American Justice Department is in talks with China to secure her release. So could that potential deal secure the release of the two Canadian men? Let's bring in Mercedes Stevenson. Mercedes?
Robin, right now that answer remains unknown. On Friday, Prime Minister Justin Trudeau wouldn't comment on the alleged deal between China and the United States. On the West Block, Deputy Prime Minister Chrystia Freeland will be joining us with her take. She is hesitant, as you can imagine, to comment on the case because of sensitivities around the two detained Canadians. But here is some of what she had to say about her personal views on China.
One thing which is personal to me, Mercedes, when it comes to China. And that is, when I was foreign minister, I worked hard on the cases of Michael Kovrig and Michael Spavor. I got to know the families of these brave Canadians. And it is totally unacceptable to me that they are not here in Canada. Canada's priority is always going to be to get these brave Canadians home.
I'll talk to Freeland about whether she has any reassurances from the incoming Biden administration that the release of these two Canadian citizens will be a priority. Freeland says it's important to work with the Biden administration, but at the moment, it is still President Donald Trump who is in charge. That given the Trudeau government has a very good relationship, she says, with President-elect Joe Biden.
They know, as do American political leaders across political lines, know that this is a priority for Canada. We've had great support in the House, in the Senate, for Canada, for Michael Kovrig and Michael Spavor. We've had some bipartisan votes and support there, and that's important.
And Robin, as you said, next week marks the 2-year anniversary of Michael Spavor and Michael Kovrig being held in China. It's clear that whatever happens in the Meng Wanzhou case, there will be an impact on their detainment. And we will certainly be watching that story closely over here on the West Block. Robin?
All right, thanks for that, Mercedes. Still ahead, a BC family's final push to get custody of their grandchildren in Peru. Thousands gathered outside the Indian consulate in Toronto to show support for farmers in India. Similar demonstrations were held in other parts of Canada. Farmers have been protesting India's new laws, which deregulate the price of crops. A BC couple is making one last legal push to see their two grandchildren. Next week, their lawyer will appear before Peru's Superior Court to ask for custody of the 10 and 7-year-olds, or at the very least, visitation rights. The children's father is a fugitive, charged with killing their mother, and the children are living with their paternal grandmother. As Romina Dea reports, the family says this latest court fight is their last hope.
One last fight to see their grandchildren. The decision now in the hands of the Superior Court in Lima, Peru.
This being our final shot, I really, really wish that this group of judges does a serious job in looking after the welfare of these children.
Look at it objectively.
Al and Kathy Kasatkin say they've been banned from visiting their grandkids, 10 and 7, who are currently living with their paternal grandmother.
We're doing this because we love them, and that their mother loved them more than life. Kim died for her children. She died because she stayed there for her children.
Lima, November 26th, 2016. It is the last time Kimberly Kasatkin is seen alive. Her partner, Christopher Franz Betoki, has been charged with femicide, the killing of a woman under Peruvian law. Kasatkin's body has never been found, but chilling surveillance video from the couple's building reveals Franz moving a heavy bag he can barely lift. According to court evidence, Kasatkin's body is suspected to be inside. Franz denies it, claiming it's camping gear. Franz is now a fugitive. A criminal trial impossible until he's found. 17 trips to Peru. The Kasatkins have spent their retirement savings fighting for justice. They wanted to be in Lima for this final custody battle, but then COVID hit.
You know, my heart doesn't give up, but it's like banging your head into a brick wall.
The custody case set for December 9th. The Kasatkins hoping they're at least granted visitation. If they don't win, that's it.
I'm exhausted from it. We've had so many trips and so many frustrations. It's time to just say we did what we can, and I accept that I've given up. I feel bad about it, but at the same time, this can't go on.
Ramina Dea, Global News.
Time to shine. Up next, the cover girl changing the world, and she's just 15. Britain's Royal Air Force captured these rare images of what's believed to be the world's largest iceberg. It measures around 4,200 square kilometers. That's more than 6 times the size of Toronto. The iceberg is drifting towards the British Overseas Territory of South Georgia. A teenager from Colorado has been named Time Magazine's first ever Kid of the Year. Gitanjali Rao is a scientist and inventor, and she's only 15. And in her short career, she has created apps to tackle contaminated drinking water, cyberbullying, and the opioid crisis. Rao beat over 5,000 nominees for the title.
I don't think I can say there was like an aha moment where I was like, this is what I want to do. It was rather just like this continuous like learning and loving more about STEM and science and technology. I cannot see a world filled with kindness without science and technology being involved. I've been wanting to change the world, and hopefully I am changing the world.
The teen says she wants to prove you don't have to be an older white man to be a celebrated scientist. Time says the new title will be a barometer for the rising leaders of America's youngest generation. And that is Global National for this Saturday. I'm Robin Gill. Tonight, your Canada is the Vancouver skyline. Thank you for watching. Good night.